Hey guys, how's it going? This is FixerMed. Welcome to my ECG Skills Builder Workshop, where I'll be teaching you all the fundamental knowledge and skills you'll need to read and interpret an ECG in a quick and effective manner. This will be part 6 of my multi-part video series of doing so. So without further ado, let's go ahead and get started on today's content. So today we'll be focusing on the PR interval. So for some background information about the PR interval, initiation of atrial depolarization signals the beginning of electrical activity, which leads to ventricular depolarization. Electrical impulses travel from the SA node through the atria and then to the AV node. Conduction proceeds through the bundle branches. Deviations in the PR interval indicate potential conduction delays such as AV block. And I have the picture to the right showcasing the area that consists of the PR interval for a nice visual representation when you're reading an ECG. Moving on, some characteristics of the PR interval. Its location extends from the beginning to the onset of the QRS complex. Duration of the PR interval is typically 0.12 to 0.2 seconds. This is less than one large square on ECG paper. Configuration, it's usually upright or positive. Deflection is also typically positive. Moving on, let's go ahead and take a look at different variations of the PR interval. So we have the short PR interval, where the impulse originates in an area other than the SA node, like a junctional arrhythmia. We have prolonged PR intervals, where impulse is delayed as it passes through the AV node, in examples like the first or second degree AV block. And then we have depressed PR intervals that can be seen in pathologies like pericarditis. So now that we have a good background on PR intervals, let's go ahead and take a look at some recall-based questions to see if you guys have retained the information from today's presentation. What indicates potential conduction delays, such as AV block, in an ECG reading? All right, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. In an ECG reading, deviations in the PR interval indicate potential conduction delays, particularly atrioventricular block. This interval represents the time taken for electrical impulses to travel from the SA node through the atria to the AV node. Any prolongation or shortening of this interval may suggest abnormalities in the conduction pathway, such as delayed conduction through the AV node, which is characteristic of AV block. Therefore, the correct answer is D, deviations in the PR interval. Let's go ahead and take a look at why the other answer choices are incorrect. Prolonged QT interval. A prolonged QT interval indicates a lengthened duration of ventricular depolarization and repolarization, which can predispose individuals to ventricular arrhythmias, but does not specifically indicate AV conduction delays. Elevated ST segment. An elevated ST segment is associated with myocardial injury or infarction, not with conduction delays. Widened QRS complex. A widened QRS complex suggests abnormalities in ventricular depolarization, such as bundle branch blocks, but does not directly indicate AV conduction delays. Absent P wave. An absent P wave may suggest SA node dysfunction or atrial fibrillation, but does not specifically indicate AV conduction delays. Moving on, let's take a look at the next question. Which condition is characterized by an impulse originating in an area other than the SA node, potentially leading to junctional arrhythmia? All right, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. Atrial fibrillation is characterized by chaotic electrical activity in the atria, often resulting in impulses originating from areas other than the SA node. This irregularity can lead to junctional arrhythmias, where the atrioventricular node takes over as the primary pacemaker, causing abnormal heart rhythms. Therefore, the correct answer is A, atrial fibrillation. Moving on to see why the other answer choices are incorrect. Sinus bradycardia. Sinus bradycardia is a condition where the heart rate is slower than normal, but the impulses still originate from the SA node. Ventricular tachycardia. Ventricular tachycardia originates in the ventricles, not in areas other than the SA node. Premature atrial contraction. Premature atrial contractions occur when an impulse originates in the atria before the next normal impulse from the SA node. However, it does not necessarily lead to junctional arrhythmias. Heart block. Heart block refers to conduction abnormalities at the level of the AV node or bundle branches, which may lead to AV nodal or infranodal junctional rhythms, but does not directly describe impulses originating from areas other than the SA node. Moving on to see the next question now. What describes the characteristics of the P wave in a standard electrocardiogram? I think I gave you guys enough time here. If you need more time to answer the question, please feel free to pause the video. Otherwise, moving on now. The P wave in a standard ECG represents atrial depolarization and extends from the beginning to the onset of the QRS complex. This indicates the initiation of electrical activity leading to ventricular depolarization. The amplitude of the P wave is typically smaller than that of the QRS complex. Its duration ranges from 0.12 to 0.2 seconds, which is shorter than one large square on ECG paper. Additionally, the configuration of the P wave is usually upright or positive with a typical positive deflection. Therefore, the correct answer is E, extends from the beginning to the onset of the QRS complex. Let's go ahead and see why the other answer choices are incorrect. A, extends from the onset of the QRS complex to the end of the T wave. This description aligns more with the PR interval, which extends from the onset of the P wave to the beginning of the QRS complex. B, typically has an amplitude greater than the QRS complex. The P wave typically has a smaller amplitude compared to the QRS complex. C, duration ranges from 0.2 to 0.4 seconds. The duration of the P wave typically falls within the range of 0.12 to 0.2 seconds, which is shorter than the stated range. Usually inverted or negative in configuration, the P wave is typically upright or positive in configuration, which indicates atrial depolarization. Let's go ahead and take a look at the next question. Which condition is characterized by delayed impulse conduction through the atrioventricular node, potentially leading to first or second degree AV block? All right, I think I gave you guys enough time here. If you need more time, please feel free to pause the video. Otherwise, moving on now. Junctional arrhythmia is characterized by impulses originating in an area other than the SA node, often near the atrioventricular junction. This can result in a delay in impulse conduction through the AV node, leading to first or second degree AV block. Therefore, the correct answer is C, junctional arrhythmia. Let's go ahead and see why the other answer choices are incorrect. Atrial fibrillation. Atrial fibrillation is characterized by chaotic electrical activity in the atria, not necessarily delayed impulse conduction through the AV node. Sinus bradycardia involves a slow heart rate originating from the SA node, not delayed impulse conduction through the AV node. Pericarditis. Pericarditis typically manifests as ST segment elevation or depression on an electrocardiogram rather than affecting impulse conduction through the AV node. Ventricular tachycardia. Ventricular tachycardia originates in the ventricles and does not directly involve the AV node or junctional arrhythmia. That will do it all for today's video, guys. Thank you for your attention and time. If you guys have any questions, comments, or concerns, please feel free to leave them in the comment section below. If you like this type of videos, be sure to like it and subscribe for more content like this. I hope to have this Skills Builder Workshop done as soon as possible since it's been pretty popular and been getting a lot of impressions on YouTube. So stay tuned for that. But besides that, this is FixerMed signing off. Be sure to have a great day, everyone, and good luck studying as always. Goodbye.